Welcome to the Dr. John Char Holistic Health Show. In the last show, we talked about pain in general and also about lower back pain and how the central nervous system, which is the brain, can affect all parts of the body in terms of relieving the permanent pain. Remember, now, we talked about the brain. Why it's so important? Have you gone to any of your therapists or your doctors or anything and you complain about a hip pain, lower back pain, arm pain, whatever? And did they talk about your brain? Did they talk about how the brain is so important in removing the pain or neutralizing the pain? So we're going to be talking about, and I'm going to be giving a lot of reference to the brain. The brain is important because your brain is all the memory cells ever since you were rolling around your mother's womb, how long ago, and to this present time. You have picked up different experiences of different pain from injuries, fall down, especially if you play sports. And that has been registered in the brain, called the hippocampus, as a memory cell. And there are 70 trillion cells in your hippocampus. So we're no longer looking for the source of the pain as a needle in the haystack. We are looking for a needle in the universe. So think about that. How are we going to remove the source of your pain so the pain doesn't come back? And then when the pain you feel the pain again, is it the same type of pain, the source, coming in to affect your body? Or is it the different level of experience of the pain throughout the years? The key is to find the source. Where did you experience the pain? What created the pain? Not only do you treat the end result, which is where you have location of the pain, except perhaps a lot of times if you have injuries to your tissues or something, then you might have to use more physical therapy to strengthen the muscles or give you supplements. And sometimes drug works, certain drugs, but I don't use drugs basically because we can get rid of the pain without drugs and without needles. Okay. So now we're going to be talking about your hip pain, and that's called the pelvic area of the body. Pelvic. So we're going to go back to and look at the slides again, and I'm going to tell you what is the pelvic pain. So we switch to the slides here. All right. So this is what you see right now, pelvic pain. Okay, and you can see the pelvic pain is here. And what is pelvic pain? So that's the hip. Remember. Now look at all the organs called visceral organs. How if anyone can be inflamed or have infections, will that affect the outcome of you having hip pain? And I'm going to show you some of the causes that can create a hip pain. Okay, not only muscles or nerves, but you can have organs which relate the message to the nerves to the brain, from the spine to the brain. So now you can see right here your ovary. What is the pelvic pain? Pelvic pain refers to pain in the abdomen, which is the stomach, below the belly button. The pain can accompany a wide range of conditions. It may be a harmless sign of fertility, a digestive disorder like irritable bowel syndrome, or a red flag for a life-threatening emergency. So, if you see this happening, you should consult your physician. Now, you can see right here, where is this pain? Look at the right side of the screen, or left side of the screen, and you can see a swelling there. And that is in your, your fallopian tube. If you look over here, pelvic inflammatory disease. One of the most serious complication of the pain is the pelvic inflammation disease, or PID, pelvic inflammatory diseases. This infection can cause permanent damage to the uterus, ovaries, and fallopian tube, as you can see before, swollen and red. So you can see swollen and red, this area here, swollen and red, That's the like the fallopian tube or the uterus area. You can see that, okay? And you can see that, and fallopian tube here. In fact, it is the leading preventative cause of infertility in women. Symptoms include belly pain, fever, abnormal vaginal discharge, and pain during sex or urination. This pelvic inflammatory disease, or called PID, is treated with antibiotics and in severe cases surgery. So let's see if we can do things without antibiotics and surgery. Okay, so now this is again your uterus area. You can see the ovary area here, the uterus area here, on the lower part of the screen. Okay, and you can see the tubes coming in and the bladder and everything. Okay, so now we're going to go to call chronic pelvic pain. So chronic pelvic pain occurs below your belly button and lasts at least 6 months. It may be severe enough to interfere with your sleep, your career, or relationships. The first step towards getting your life back is seeing your doctor for a diagnosis. Important. Most of the conditions we've discussed respond well to treatment. Sometimes, even after a lot of testing, the cause of pelvic pain remains a mystery. So your doctors can help by doing the proper test. And you can see right here again, that area of the pelvic again, the pelvic, and you're going down to the uterus area. All those areas can be infected, or even the colon area or intestinal areas. All these can lead to infections or inflammation leading to hip pain. So the pelvic congestion syndrome. These are varicose veins commonly occur in the legs, and they can be in the upper thighs, and they can sometimes develop in the pelvis. Imagine, most people think varicose veins comes in only on the feet, or the lower leg. You can also go up to the thighs and the hips. So blood backs up in the pelvic veins, okay, causing them to become swollen and painful. This is known as pelvic congestion syndrome. The pain tends to be worse when you sit or stand. Lying down may provide some relief. There is a minimal invasive procedure to treat pelvic congestion syndromes. Now, if you're talking about the veins or the varicose veins, a lot of times you have people that don't have good circulation in the legs. Those noticeably can be diabetic 2 type of patients. Some people call that diabetic neuropathy or peripheral neuropathy. So when the blood returns from the bottom of the feet going back, and it has to be dispelled out of the body, the blood's going uphill. You see, most time if you're standing, the blood vessels, all the weight, all the blood is stagnating in the lower leg area, and the blood has to be, you have to get some push. So if people have a sore foot, like plantar fasciitis, or sciatic nerve problems, they have difficulty in putting pressure on the balls of the foot or the gastrocnemius or the calf muscles in the back of your lower leg. And when you don't have that pressure and you're not getting enough pressure going up, so the blood is coming up towards the heart, and what happens is towards the gut and the heart, and what happens is it goes into compartments. See, like it's different from say an artery where the blood flows with no valves in there, but with the veins it has valves, and so when the blood goes into one, it's pushed through the pressure of the feet and the calves, and it pushes up. Then what happens, you have a sore foot and you don't do that, then you have the stagnation of the blood can be in the leg area, not pushing up toward the gut area. So what happens is then the blood fills up, the valve gets stuck, and then it engorges, means it starts to back up and it starts to swell, and that's when you get painful. You get painful. So now if that goes all the way from the leg, all the lower leg, all the way up to the pelvic area, you're going to have what we call pelvic congestion syndrome. Okay, so now, what about the other part? We talked about the colon, especially the descending colon. Okay, and a lot of times you can see on your right of your screen, you're going to see in the loop here, it's called the sigmoid area, means where the transverse colon, which is the one that goes across the body in the gut, and it coils over, and it starts to descend down to the sigmoid into your anus. Okay, and that area can have a blockage there, or you can get constipation, or you can get irritable bowel syndrome, or you can get when people have indigestion, or they need probiotics to help you through that. So, or the lack of bacteria, which is sometimes they take too much antibiotics, they lose the friendly bacteria, and you can get areas of brain fog, okay, coming from this area. So what happens is as a bolus of food comes down here in the normal colon, you see how wide it is. You get on the left screen, and on the right screen you see how narrow it gets because you lost spasticity in those colon. And when that happens, guess what can happen? Irritable bowel syndrome. Irritable bowel syndrome, it's called IBS, is a chronic digestive disorder that causes reoccurring belly pain, cramps, bloating, and diarrhea or constipation. Doctors don't know what causes it, but there are strategies to control the symptoms. This includes diet change, stress management, and medications to treat diarrhea or constipation. So we a lot of times substitute medications with natural supplements, and we also look towards a cleansing of this area, and that means that sometimes we have to get a colonic, and colonic is like a irrigation where they have just like a high enema, and it gives you tone because they put about 2 pounds of pressure in there and push the water up through the sigmoid into the middle section of your body where the belly button is. Just below the belly button is a transverse colon, and it kind of stretches the colon tissues, and it makes it where everything was impacted in there in the walls over the years. It will sort of break it up because the pressure goes in there. The technician will sort of knead it. He would actually like you massaging it, and he will break out all these crust stuck on the walls, and then you can see it as you look through the escape valve, or the valves that you see is usually transparent. You can see a lot of the fecal material coming out. Sometimes you'll see white toilet paper, and that means some of the lining of your intestines it's really getting narrow. I mean, your intestine walls are getting thin, and that's why you're getting some of the toxins going back to the liver. So what happens also, sometimes you see food you ate last week, and what happens is when that happens, remember now, it's going to the corner of your body toward the hip, and you can get pseudo or false hip pain coming from that area, and you think you got a kind of hip pain. Now also you can get infection from that area because you see all the toxins accumulating in that area, and what happens is the tissues start to get infected with bacteria, different fungus and things like that, and what it causes in inflammation there, and you can feel like you got a hip pain. Okay, so now another area is scars. Here's scar tissues, and scar tissues can be from many sources. If you had surgery in there, remember I talked to you about getting scar tissues in an area called neuropathic? Well, you can get scar tissue from hysterectomies, bladder infections, you might have some more hemorrhoids, you did some surgery there in those particular lower part of the body. You can get a back surgery, and you can get the scar tissues to get colloidal, means getting thickening. And what happens is that it causes a squeezing when you have adhesion of the vessels underneath there and the nerves. So you're getting compression or squeezing of that. And the blood vessels or the nerves and the muscles and the organs underneath there get squeezed. Now there's about 5 nerve endings underneath the skin. That also gets compressed and sends false signals to the brain. And when that happens, the brain will interpret it and send messages down to the protocol, the motor nerve, back to this area, and this area will get tight, so the muscle will contract more. And when that happens, you can get a pain or dull aching in the hip area, okay? And so what you need to do is not getting scarred, but I mean, sometimes you get scarred, is to remove the energy or the messages that leads to the pain when the message is sent through that area, or you are infected through the spinal cord, up the vertebrae, up to the brain, and the brain interprets it as a circuit that's been broken, and consequent, it will give you a experience of pain. So that's scar tissues. Okay, very important that you remove the emotions, because everything that you have through a surgery, you had some anxieties, you had some stress, you had some anticipation of the surgery, but you already have pain already. That's why you were recommended to get surgery. And so if you had surgery, then of course you can get scars. So if you had surgery in the pelvic or lower abdominal region, such as appendicitis or appendectomy or C-sections or infection in the area, you could have an ongoing pain from scar tissues. Adhesions are a type of internal scar tissue that forms between the organs or structures that are not meant to be connected. Abdominal adhesions can cause pain and other problems depending on their locations. In some cases, adhesions must be surgically removed because they're too thick, they're colloidal, real thick. And you see that, and the tissues are getting, say, dead, sort of dead feeling. You get numbness in there. You see the scar tissue start to turn dark on you. Okay, it won't be a light color or beige color. It'll be a dark brown or dark kind of black. And if black, it means it's really, your tissues really bad off. They're degenerative. They're disease type. Okay, so now we'll talk about the next area, and that's the area where you see the colon, and that's the appendicitis. You can see the appendicitis right here on your left screen. And appendix means that it's this little sac coming off from the colon area, and it's called the appendix. And a lot of people have problems because that gets inflamed, fills up with toxic materials, and if not properly removed, it can get into the bloodstream and you get really toxic and sick. So a lot of people have the appendix removed, and when the appendix is full, guess what? You can get inflammation. And this inflammation of the appendix, a tube of tissue connected to the large intestine. The symptoms include sharp pain in the right abdomen, stomach, vomiting, and fever. If you have these symptoms, go to your ER. And infected appendix must be surgically removed, or it will eventually burst, spreading the infections within the abdomen. This can result in life-threatening complications. Okay, so now we get into this area, and this is called interstitial cystitis. Interstitial cystitis means that this is inflammation in the area of the bladder, and it's actually between the layer. It's like an interstitial fluid, which is in between, connective tissue in between the actual blood vessel and the organ wall. So it's like a connective tissue, interstitial cystitis. And so interstitial cystitis can look like this, and you can see areas where you can have a swelling in the top here, right here. Okay. Okay, and interstitial cystitis is called IC, is a chronic pain condition related to inflammation of the bladder. The cause is relatively unknown. People with severe IC may need to urinate multiple times in an hour. Other symptoms include pressure above the pubic area, painful urination, and pain during sex. The condition is most commonly found in women in their 30s and 40s. Although there is no known cure, there's always a way to ease the symptoms. So you got to remove the infection there. And see, itis means, cystitis means in the bladder, and itis is inflammation. And then now you're talking about this area here. What does that look like? That's your kidney stones. So yes, kidney stones, you can create hip pain, because where is the kidney located? It's on the side of your body, just above the hip. And so the kidney can get inflamed, and from kidney stones. So what is kidney stones? Kidney stones are globs of salt and minerals that deposit in the urine. They can be as tiny as a grain of sand or large as a golf ball. As the stones move from your kidneys to your bladder, they can trigger sudden, excruciating pain in the belly or the pelvic area. Your urine may turn pink or red from blood. Check with your doctor if you think you have kidney stones. Most of this pass out of the system on their own, but some require treatments. And there's some kidney tea, and it's made of watermelon seeds. Very good. It will dissolve a lot of your kidney stones. That's the tea, and you have to drink it 2-3 times a day. And it will help remove or dissolve some of the large kidney stones. You have it. Try that first before you start going into any medications or anything, and see if that will help you. And then you're talking about premenstrual cycle. And you can see right here the premenstrual cycle when you have ovulation. Premenstrual cycle syndrome is known for triggering mood swings and food cravings. It can also cause abdominal pain, low back pain, headaches, tender breasts, and acne. Hormonal changes may be to blame. Stress, lack of exercise, and some vitamin deficiencies may make the symptoms worse. If PMS is interfering with your daily activities, talk to your doctor and see if you will get a lifestyle changes and some supplements that will help you. And getting down to here, what is that? It's your ovaries. Here's your ovaries. And you see the mass there in your ovaries? See a little area in the light there. And that's called metaschimmers. Metaschimmers, painful ovulation. If you have painful twinges halfway between your periods, you may be feeling your body ovulate. During ovulation, the ovary releases an egg along with some fluid and blood, which may initiate the lining of the abdomen. This is called the metaschimmers, from the German words for the middle and pain, because it occurs mid-cycle. The pain may switch sides from month to month. It isn't harmful and usually goes away within the next few hours. And this is sexually transmitted diseases. See, sexually transmitted diseases. And it can be, pelvic pain is a warning sign for some sexually transmitted diseases such as STDs. Two of the most common are called chlamydia and gonorrhea, shown here through a microscope. They can often occur together. They don't always cause symptoms, but when they do, they may trigger pelvic pain, painful urination, bleeding between periods, abdominal vaginal discharge. It's important to seek treatment immediately for serious complications. And finally, you're getting into ectopic pregnancies. And ectopic pregnancies is here when you get the swelling there, and you can see it in the uterus. And this is life-threatening emergency, and it requires immediate treatment, and happens that from an embryo implants and begins growing somewhere outside the uterus, usually the fallopian tube. So the symptoms include sharp pelvic pain or cramps partially on one side, vaginal bleeding, nausea, dizziness. Okay, so now you've seen most of this right here, and we've gone through the ovaries can cause a problem, menstrual cramps. You can also cause from urinary tract infections, and also ovary cyst. Okay, so now with all those in mind, you have a lot of things that can cause hip pain. So don't be confused with just pain from, say, an injury. Yes, you can get pain from an injury, but also look towards the different types of disorders that you may have. Seek your doctor if you have these problems. We'll talk about the sciatic pain on the next program. So tune in to our program. It's called basically Dr. John Char Holistic Health Show.